Today, we are going to take a deep dive into the science of your bite. In dentistry, it's called dental occlusion. And believe me, it is so much more than just having a pretty smile. It's actually a critical part of a system that can affect everything from how you digest your food to whether or not you get headaches. So let's get right into it.
So, have you ever wondered why your dentist seems so obsessed with how your teeth fit together? Well, it's because the alignment of your bite, your occlusion, is a super important piece of a much, much bigger puzzle that involves your health, your comfort, and yeah, even how you look.
Okay, let's start with the absolute basics. The term dental occlusion is just a fancy way of talking about the contact between your teeth. It actually comes from a Latin word, occludere, which means to close up. So it's all about the relationship between your upper and lower teeth whenever they touch. But this isn't just about teeth. A good bite is really the foundation of your entire chewing system. Dentists call it the masticatory system, and it is an incredible machine. It's not just your teeth, but also your jawbones, the joints, and all the powerful muscles that make the whole thing work in perfect harmony. So, in this explainer, we're going to start with the jaw's engine, the TMJ. Then, we'll uncover the blueprint for what makes a perfect bite, and look at what happens when things get a little misaligned. After that, we'll see how your jaw actually moves, and to finish up, we'll reveal the absolutely stunning hidden geometry of your teeth. All right, let's start with the powerhouse behind every single movement of your jaw, the temporomandibular joint. You probably know it as the TMJ. This is the sophisticated little engine that drives your entire bite. You actually have two of these joints, one on each side of your face, located right in front of your ears. They create that crucial connection between your movable lower jaw, that's the mandible, and the rest of your skull. Now here's where it gets really interesting. See that little thing in there? That's the articular disc. You can think of it as a small, tough, shock-absorbing cushion. But it does something even more amazing. It completely splits the joint into two separate compartments, an upper one and a lower one. And that gives it a very unique superpower. This two-part system is what makes the TMJ so special. The lower compartment acts like a simple hinge, for the rotational movement of just opening and closing your mouth. But at the same time, the upper compartment is a gliding joint. That's what allows for what we call translational movements. That's sliding your jaw forward, backward, and side to side. So it's basically a hinge sliding joint, all wrapped up in one. Pretty cool, right? And of course, to keep this super complex joint under control, there is a whole network of ligaments, like the ones you see here. They pretty much act like guide ropes. They provide stability and they limit the joint's range of motion so your jaw doesn't, dislocate. Okay, so we've got our engine in place, but what does a perfect bite actually look like? Well, let's take a look at the blueprint that dentists use to define what an ideal occlusal relationship is. To really understand this blueprint, we have to travel all the way back to 1899 and meet a guy named Dr. Edward Engel. He's known as the father of modern orthodontics. Why? Because he was the very first person to create a simple classification system for bites. And amazingly, it's still the standard we use today. This right here is Engel's Class 1, also called neutral occlusion. This is the ideal. The most important part is the relationship between those first big molars. In a Class 1 bite, the pointed tip, or cusp, of the upper first molar fits perfectly into the groove of the lower first molar. It's like a key fitting perfectly into a lock. This single relationship is the reference point for literally everything else. Now, when you have that perfect Class 1 alignment, it allows for something called maximum intercuspation, or MIP for short. This is just the position where the maximum number of your teeth are all touching at once, which creates the most stable and efficient platform possible for chewing. But what happens when things don't line up so perfectly? Well, these deviations from that ideal bite are called malocclusions. And listen, these aren't just cosmetic issues. Misalignments can be the root cause of jaw pain, headaches, and even uneven tooth wear. So let's explore the most common types. Okay, check this out. On the left, you see our Class 1 ideal again. But on the right, that's a Class 2 malocclusion. See how that key in a lock relationship is totally off? The upper molar is now positioned forward compared to the lower one. This is what usually gives the appearance of an overbite. And now, let's compare the ideal on the left to a Class 3 malocclusion on the right. In this case, it's the opposite. The lower molar is positioned too far forward relative to the upper one. This is what typically creates the appearance of an underbite. So far, we've pretty much been talking about the bite when it's closed and still. That's what we call static occlusion. But your jaw is almost always in motion, right? So let's dive into the really elegant mechanics of dynamic occlusion. When you move your jaw from side to side, something really cool called canine guidance is supposed to happen. In a perfect bite, as you slide your jaw to one side, only the strong, pointy canine teeth on that side should touch. It's this clever little mechanism that causes all the other teeth to separate just a little bit, or disclude, protecting them from really harmful sideways grinding forces.
And there's a very similar protective mechanism when you slide your jaw straight forward, a movement called protrusion. Here, your front teeth are meant to make contact and guide that movement. This simple action lifts the back teeth apart, protecting your molars and premolars from stressful contacts they were just not designed to handle.
All right, for our final section, let's uncover one of the most elegant parts of dental occlusion, the hidden geometry in how your teeth are arranged. And trust me, this is not random. It's all designed perfectly for function. So if you were to look at your dental arch from the side, you'd notice that the chewing surfaces of your teeth don't actually form a flat line. They form a slight upward, kind of smile-like curve from the front to the back. This is known as the curve of Spee, and it helps make our chewing motion way more efficient. Okay, now if you were to look at your teeth from the front, you would see another curve, but this time going from side to side. This is called the curve of Wilson. Your back teeth tilt just slightly inward toward your tongue, creating this curve that helps your jaw rock side to side super efficiently when you chew, almost like a bowl and pestle. So let's do a super quick recap of the key takeaways. First, your bite is an incredibly complex system, and it's all powered by that unique hinged gliding joint, the TMJ. Second, we learned that Engel's Class 1 occlusion is the gold standard blueprint for healthy bite. Third, those common misalignments like Class 2 and Class 3 are really just specific shifts away from that perfect relationship. And finally, the teeth themselves are arranged in these elegant, functional curves that are built for efficiency.
We've covered the entire blueprint, from the engine of the TMJ all the way to the geometry of the final design. The most important thing to remember is that this whole intricate system is working every single time you talk, chew, or even smile. So here's a final thought for you. Now that you know the blueprint, what do you notice about your own bite?